Good afternoon, everyone, and welcome to another episode of College and Career Pathways, where every Monday, Wednesday, and Friday at 2 p.m., we provide you with information on various colleges and universities, financial aid resources, technical schools, training programs, skilled trade professions, employment opportunities, career readiness skills, and career exploration, all designed to help you make the best career decisions possible. I'm Tony Curitin, and today we will be talking with Flint Healthcare Program of Genesee County. That's a long name.
Close enough.
We will be speaking with Penny and Natalie. Welcome, you guys. We are so glad to have you.
Well, thanks for having us. My name is Penny Poplar. I am the director of the Flint Healthcare Employment Opportunities Program. Our parent organization is the Greater Flint Health Coalition, and I have with me Natalie Reideman. She is a career advisor, and also she'll be working with me on outreach. So we wanted to just speak to you guys and provide you some information about our program. I'll give you a little background about our organization as well. Is it okay if I go ahead and pull up my PowerPoint?
Absolutely. Absolutely.
All righty. Okay, as I stated, we are part of the Flint Healthcare Employment Opportunities Program. Our program has actually been around for 19 years, and we're in the Flint and Genesee County area. We provide free healthcare training for those that are interested in entry-level healthcare. So just kind of getting your foot in the door, getting a feel for healthcare, and seeing if you want to maybe take your healthcare training further. Um, Here's our list of our staff members. As I mentioned, Natalie Reideman, Rosalind Field, she's a career advisor, Quan Young, Joaquin Sharp, they're all career advisors. And then Shannon Coulter, she is our career and employment engagement person. So she kind of works with me on the back end of helping me manage the organization and then reaching out to employers for um, uh, job placements for participants that come through our program. So just a little background about our organization, the Greater Flint Health Coalition. We are a nonprofit organization. Our actual organization has been around since 1992. We focus on different healthcare disparities, issues, or problems that may be going on in our community. A few of the programs that we have right here is our Commit to Fit, which focuses on healthy living, maintaining healthy lifestyles. So we provide different programs in the city of Flint, free workout classes, cooking classes. We have a few programs for children and within the schools. And then our CHAP program, which is our community healthcare access program, where we provide free access, where we assist you with getting access to healthcare. And it could be a means of anything. You may not have a primary provider, so we may assist you with that. You may have trouble getting to your doctor's appointment, so we can help you find rides to get there. You may have babies that don't have car seats. We can assist you with that. Anything that's going on that may be preventing you from getting health care, we try to eliminate those barriers and help you with that. Our main point of contact with that is through the doctor offices. They have a referral program where they can refer people that may be having those issues. But also, if you reach out just to our office or any community members, they can refer you pretty much to this program. And then we also have the Flint Registry, which is formulated after the water crisis. And it is a way for people to get resources if they have been affected by the water crisis. And these are just a few. We have an array of different programs that we use, as I stated, to help combat healthcare disparities in the city of Flint. The FHEO program, as I stated, was started in 2002. And it was started because of what was going on in Genesee County in regards to General Motors was our main source of income or careers in that area. And at that time, they were kind of pulling out and leaving. And so they decided to do a research or determine what other career fields would be viable in the city of Flint. This was done by the Mott Foundation and the UAW in the area. And they found out that it was healthcare. There was a lot of need for healthcare professionals, but it wasn't a lot of healthcare professionals. And so they reached out to our organization because we are an organization that partners with healthcare professionals in the area, educational facilities, and to help develop a program that can help those combat those issues in regards to not a lot of healthcare professionals in those areas. And so it was formulated in 2002. We have a committee that governs our program. It's called our Oversight Committee. We have the main healthcare providers in the area sit on our committee. For instance, the hospitals, Hurley, McLaren, Genesis, Hamilton, which is a large clinic in our area, and then also the educational providers, Mott, GISD, also U of M Flint, and we all kind of come together to figure out what are the best healthcare trainings that we can offer, where people can get quality training and be able to gain employment once they finish. And this is basically pretty much how we loop everything together with our employers, figuring out what their needs are and bringing that to the residents. One of the things that we have found out is that our employers have told us they could pretty much train anybody, but they really need them to have those employability skills in order to be successful in the workplace. And so our program is designed to help provide you those skills. We survey our employers every year to figure out what they're hiring for, and what they're finding is a weakness in regards to new employees that come into their organizations. And we try to train you on what they're saying they're looking for. These are our program partners. We partner with GST Michigan Works. They're a funding partner. A list of our oversight committee board is there. We work with Flint Strive for our life skills and employability skills, and I'll explain a little bit more about that. And then the colleges in the community that we work with, and an array of different more. So with our life skills, with our program, these are some of the things that you will receive. We want to make sure that we're training people that have compassion, that go into healthcare, and it's a good fit for healthcare. Everybody is not a good fit for healthcare. You may have some people that say, I want to be a CNA because they hear their friends are CNA, but they don't understand the grunt work that goes beyond being a CNA. And then also that compassion piece, becoming close with someone, and then you go there one day and then the next day they're gone. So all that plays a part in us screening and making sure you're a good fit for the training that you're interested in. We do an academic fit, and we do also a healthcare assessment. Academic fit is just to make sure that we're not putting you in a training that you won't be successful in. I never try to set anybody up for failure. So we want to make sure that you have the good, you're able to comprehend what training that you're interested in. We provide you 120 hours of professional life skills training and career exploration. And basically, this is where we provide you those employability skills that employers look for. We also bring in people that work in those fields to talk about a day in the life as a pharmacy tech or a medical assistant or a CNA, just so you can get an understanding of what you may be getting yourself into. And then once you complete that, you're able to go into our credential occupational training. We offer about 7 different entry-level trainings, CNA, medical assistant, pharmacy tech, phlebotomy, dental assistant, health unit coordinator. So we have an array of different trainings that you can possibly get into. Now we only offer 1 training per person. I have to be able to spread the love. And so, and I don't expect, for this to be most people last stops. I think that this is a beginning step for you, and then to take this and move forward within your healthcare career. We offer career advisement, and that's where our career advisors come in. We work with you from the beginning to the end, making sure that the process is clear and you have an understanding of what the expectations is on the program, helping you remove any of those personal barriers, even being a sounding board for you when you get frustrated. And then after you complete your training, helping you get that employment, that job that you're looking for. We also provide supportive services based on funding availability, but we can assist you with an array of different things. We can assist you with scrubs, books. Most of that is books and scrubs is mostly paid for, but if you get a job and you need scrubs, we can help you with that. We can help with car repairs. We can help with licenses, and we mainly take care of that on the back end as well. So it's a lot of different things. It's just based on individual needs. That's why we ask you that you stay in contact with your career advisor. You let them know what's going on so we can assist you. We offer empowerment sessions as well. And those are just giving you tools that you can use throughout your daily lives to move forward. We bring in a local credit union person that talks about how to get your credit score together, how to keep it together, how to purchase a home, just different things to help you move forward in your life and in your career. And then, as I stated, job development assistance will help you with your resume, interview skills, and that employer connection. We work with a lot of different healthcare employers in the area. 9 times out of 10, if you do what you're supposed to do, you're going to find a job, and we're going to help you find that job. Some people don't even need our assistance. They already have a hand in once they're done. But like I said, we work with the local hospitals in the area. We make sure that you get certified. We pay for that. And then other small entities in the area as well. So, eligibility requirements. We are a workforce development program, and the initial way to become eligible is to meet the income requirements. Now, this is not the only way. We have an array of different ways, but we know if you meet this, you're eligible. But for different, we can take it case by case and determine other eligibilities. It could be low income, it could be single parent, it could be receiving any food assistance or cash assistance from the state. It could be a lot of different things that we can look at. So don't let this discourage you. We have a special incentives for what we call our out of school youth, which is 18 to 24. I like to per se say young adults, but they call it out of school youth, 18 to 24. Have to be a high school graduate, low income or basic skill deficient. We could, either one will fit. These are just ways that definitely qualify you. If you're homeless, runaway, foster care, pregnant or parenting youth, individual with disabilities, or low income and require additional assistance. So it's a lot of different ways we can get you qualified. So special components for our youth program is we offer talent tours. We haven't been able to do this since we've been going virtual, but hopefully this is something that we can get back into. We're looking at maybe doing some virtual college tours. But what we would do is take you to different facilities so you can get a tour and see what goes on in a healthcare environment, and see different careers. So we've been to Hurley Medical Center before. We got a tour of the hospital, the lab area, so you can see how the lab area works. And they bring in different healthcare professionals to speak to you in regards to what they do in a day in the life of a doctor or a nurse. And we've also been a diplomat pharmacy and gotten some information, and then different colleges as well. Subsidized employment is a opportunity for you to gain some work experience, and we pay for it. So we pay for up to, I believe it's 160 hours of work experience, and then an opportunity for you to be able to obtain a permanent job. Our main organization that we work with this on is McLaren Flint, and they've hired probably 80% of the people that we place there. So what they generally do is if you haven't been trained yet, they'll place you somewhere like transportation or dietary or something like that. And you can work and get experience and see what goes on in a hospital. And then if you are a good employee while you're there, there's a possibility for you to get hired on. If you've already gotten your certificate, which we've had that happen with our CNAs, they've been hired on as CNAs and been able to work on the floor as CNAs. So it's a great opportunity to get your foot in the door. We've done this with McLaren. We've done this with a pharmacy company called Sendera. We also done it with Hamilton Community Healthcare Network. Also my community college as well. So it's a really great opportunity for you to get some experience and get hired. Performance incentives. So we give you monies for just doing what you said you're going to do when you come in this program. So you complete your training, you get $100. You complete subsidized employment with no issues, you get $100. You get a job, you get $100. So you get $300 just for doing what you said you were wanted to do. and how these things have worked. For instance, talent tour, we've had a gentleman do a talent tour at Diplomat Pharmacy, speak to them and make some connections. And once he finished his pharmacy tech training, he got hired at Diplomat Pharmacy. So it's beneficial. It's worked for us. I had a young lady that worked at Hamilton and did her subsidized employment. She actually did it in HR, but she was a medical assistant. Once she got finished with her medical assistant, HR remembered her and they hired on as a medical assistant. So it's been a very great way for us to make connections for our youth. I'm moving you guys around a little bit. So, all right. So our professional life skills and career exploration training, for our employers, this is the most important piece. This really, if we can say that you've been through this training, it's kind of us putting a stamp on you that you've gained the employability skills that they asked us to provide to you. And so we talk a lot about patient care. One of the biggest things last year is they mentioned hospitality in the hospital. So they were seeing, employees not really taking ownership or accountability for certain things. They may see a piece of paper on the floor and not pick it up and walk right past it. If this is your house, your work environment, you want to take ownership and pride and make sure those things are taken care of. Even if it's not your realm of service, it's still, you want to make sure that it's fitable for the patients that come through. And then also treating patients like guests, making sure they have quality care. So those are some of the things that we talk about. Confidentiality of patients and employees. That's big in the hospital. I know some of you may have heard of HIPAA, but we just have to reiterate that and make sure you have a good understanding that you can't see Aunt Sally in the hospital and then call your mom and say, hey, guess what? I saw Sally and she has, that's against the rules. So we just make sure you have a good understanding of HIPAA. And then understanding of healthcare environment and missions, just understanding that everyone is different, respecting leadership and management, and then conflict resolution. Hospitals are a very busy place, and they want to be able to make sure that you can resolve things like seeing a piece of paper on the floor and being able to pick it up instead of just leaving it or trying to find somebody to do it or take care of it. You got to have those good problem solving skills. And then on the right side, the basic things that you would think everybody should know, but they don't, is punctuality, understand how to be there on time, especially in the healthcare environment. You may have a senior that's been on the job 12 hours and she's ready to go, but she can't leave until you get there. Or a patient has medicine they have to get at 12:15 and you arrive at 12:20 and they can't get their medicine. So all that plays a part when you're in the healthcare. Staying professional, being able to communicate things well, multitask, team management, teamwork. These are all things that we talk about in the healthcare environment during our training that are very important in the healthcare environment. We also talk about personal things that may be going on that you should not bring in the workplace, helping you remove those barriers as well. So these are some testimonials that we required over the years for people that have witnessed how beneficial our life skills and healthcare career exploration program has been. We have a testimonial for Rachel Hewitt, who is the Vice President of Human Resources at McLaren. Dina Scully, she's no longer at Charter, but she was the dean over their pharmacy tech program. And then Danica, who was actually a participant. Sometimes we get people, do I really got to take that life skills class? I don't need that. But every time at the end of the class, that person always said they enjoyed it and they got something out of it. Even the most seasoned people get something out of it. And sometimes it's just being there to assist someone else. You never know when you're placed to do something and how you can affect someone else. And so it's a really good program. The program's been around for 19 years, and I think they've only not done the life skills program 1 year out of it, and they had to go right back to it because they needed it there for the program. And it also simulates like a work environment. So you have to be there at 9. It's not over till 4. You get lunch breaks, but you can't be late. You can't call in. They give you call-in days or whatever it is. I think it's like 2 days. So they treat it like a work environment so we can start preparing you to go to work and school. All right. So how do you qualify for our program? You have to be a Genesee County resident, have to have a high school diploma or GED. We talked about the household income, but as I stated, that's not just the only way. There's other ways we can look at to qualify. We do ask that we run a background check and we ask that you take a drug test that we pay for. Uh, Completion of healthcare assessments. We talked about the healthcare assessment and then also the academic test. You will have to participate in an interview. We bring in our healthcare professionals in to help us interview the HRs from the companies that we partner with. And you want to be able to speak to why you want to go into that healthcare field and be compassionate about what you want to do. And treat it like you're doing a job interview, because there's been plenty of times I've gotten a professional HR person say, Penny, when that person's done, let me know. I want to hire that person. So just keep that in mind. A commitment to communicate with your career advisor. I cannot reiterate that enough. Sometimes we get people that come through and they get what they need and they're gone. But we may have other opportunities for you. You may have been working your job and you want something new. And I get an employer that said, I need a seasoned person. And I reach out to you and you don't answer, or your phone numbers change. Please keep us updated on that information. So just stay connected. You may be having trouble with training. Don't just drop out. We can reach out to our training providers and say, hey, can this person pick up with the next group? Or, if it's at the college, if this person is having some family issues, what can we do? And they may say we can give them an eye and they can pick it back up. You never know what we do. That's why we build these partnerships and these relationships so we can help you move forward. And then also motivated to get through training and employment. I say employment also because I get some people that are career students and they're like, what other program can I do? What other program I do? No other program. We want you to get through this training and get a job. That's the end result, is getting a job. That's how we are able to continue to get funding. As of right now, I believe we have about an 88% employment rate. So that means 88% of the people that complete credential training get a job as in the healthcare field, which is really good. So we want you to continue to move forward and work in your field and then advance from there. As I stated, these are the trainings that we have right now. Certified nurse assistant, which is about a 4-week program. Dental assistant, we have a couple different places that we can look at offering that. We built a special relationship with Ross Medical College where they offer dental assistant. I believe it's like an 8 or 9 month program, but we've been able to get that program based on, so that program is normally about a $15,000 program. We can't pay $15,000. So what we did is, if a person can receive full Pell, we pay a portion, they pay a portion, and the rest is forgiven. So about $5,000 is forgiven. So when you walk away from that training, you don't have to pay anything out of pocket, no student loans or anything. Health unit coordinator, that is basically a semester course, unless you have to take prereqs. Then it could be roughly 2 semesters, but it's at Mott Community College. Medical assistant is a 6-month program offered through Mott Workforce. Medical billing and coding, again, that is offered through Ross. And same deal as dental assistant. You just have to be able to receive Pell, and then we'll pay the rest and receive a scholarship from the school. Pharmacy tech is a 5-month program. And then phlebotomy is offered through the college, which is a semester program. And then once you complete that, we pay for all certifications once you're done. And then we're able to work with you in employment and move you forward. So as I stated before, all we really ask for is your time and commitment. We'll have to do a background check and drug screen. And I believe that's pretty much it. So these are some of our outcomes. Since 2015, more than 2,600 people have applied. Over 1,000 people have been accepted. Over 800 have graduated. And like I said, about an 86, 88%. We just ran the numbers again. So 86, 88, roughly in there in regards to employment. Any questions? Or do I have any people that's in?
I have a question.
Okay.
Hi, I'm Jason. I was just curious, out of the programs that you showed, the 8 or 9 programs that you showed, which one of those is the longest? I hear that there's a range of 4 weeks for some of them. What's the longest one?
I believe the dental assistant is the longest. It's about 8 or 9 months.
Okay.
And the SENA is the shortest, which is 4 weeks.
Gotcha.
Yep.
Thank you.
You're welcome. Any other questions?
I actually have a question, Penny.
Okay.
How has the pandemic impacted the way students are trained?
Well, we recently had that we recently completed a new group in life skills, and we went back and forth with having life skills in person or having it via Zoom like this. And our provider decided that the best thing to do is have it in person because you can't work from home with healthcare. And so we wanted them to be there to start getting their minds ready to be there for training. All our training facilities for healthcare are still open, and people are able to go and attend. The biggest holdup for us is that with like our SENA program, they have to go to like a nursing home and do what they call clinicals, and we've had a holdup with that because there may have been a case of COVID and they can't move forward. And so hopefully we'll be able to get our next group growing at the end of this month when they complete SENA. So we still been moving along. We're here. It slowed up a little bit at first when it first happened in March because nobody knew what to do and it was just like, what? But now when we started our groups back up in September, our training programs have been open.
When is your next cohort class?
We are recruiting right now, and we'll be recruiting for the next 3 or 4 weeks. We start our interviews, I believe, the second week of February. And we'll still do some recruitment there. We can get people in, they can get what they need, and we can move them along. But our life skills class actually starts the second week of March. And so by the time that class starts, that'll be the end for that particular group. So if you have anybody that's interested, they should get in now so we can move them along so they can start life skills in March and be able to start their training starting April, May.
Okay, now you say they have to be a resident of Flint. What proof of residency do you require?
Just driver's license.
Okay.
Yep, just driver's license.
And you're in healthcare. Are you going to offer any other programs like in automotive or IT or manufacturing?
No, to receive training in those areas, you have to go to Michigan Works.
Okay.
Yeah. I believe it was in 2017 or 2018. We were named the healthcare provider for Michigan Works. So anybody that's interested in healthcare that goes to Michigan Works, they're going to send them to us.
And this program is absolutely no cost to the student.
Nope, just time. We
And
pay for training, we pay for books, we pay for, bus passes. If they need bus passes to get to school. If it's far, we may be able to provide mileage. It just depends.
Okay. Any other questions, you guys?
I just wanted to thank you so much. This is such a great program, and it's awesome that we'll be able to share it with our students. So I'm really excited. I took a bunch of pictures of the screen. I know you're recording it, but so I'm going to definitely share it with my students. Thank you so much.
Good. I'm glad.
Yes, thank you.
Thank
you. You're welcome. You're welcome. And Tony has my information. So if you guys have any questions or anything, please feel free to give me a call.
Well, it was a great presentation, Penny. Again, I love your program. And the reason why I asked about the residency, because I have already had students and other people inquire about that. And they're like, well, what if I just, move there temporarily, So.
I mean, if they got an ID or a license, I don't question it. I don't ask how long you've been at that residence. I don't ask any of that. So if they got something, hey, send them our way.
Good deal. All right. Yeah. If there aren't any more questions, then we will wrap this up for today. And thank you again, Penny and Natalie, for your time. We appreciate the wonderful information you provided. I know it's going to be a great help to our students as well as our other staff. And I will look forward to reaching out to you again and doing this all over again.
Okay, sounds good. I appreciate that. Once a quarter or every other month, I'm fine with doing that. Just let me know.
Good deal, good deal.
Okay.
All right, thank
All
you
right.
guys for joining, and you guys have a great weekend.
Same to you.
Thank you,
Bye-bye.
guys.